From KATV, winner of the Edward R. Murrow Award for Best Newscast, this is Channel 7 News. Good morning, Arkansas.
We're going to introduce you to one Arkansan who is able to get active and enjoy this spring weather more than he has in some time, thanks to double knee replacements. And we'll also meet the surgeon responsible for the great work. That is Dr. Richard Nix with Baptist Health and Ortho Arkansas.
And that's a great story. I can't wait to hear about that, especially like you said with the warmer weather coming.
It's amazing what they can do now.
And welcome back to Good Morning Arkansas. The weather is warmer, and hopefully we're all getting more active as more sun shines outside. Our guest this morning is able to do a little more with his life thanks to double knee replacements. And we've got Jim Moore from El Dorado, and we also have Dr. Nix from Baptist Health. They're talking about a new campaign called Keep On Amazing to tell us more about knee replacement. And Jim, I just kind of want to start off with you. Tell us kind of, I guess, actively what your lifestyle was like before you had the double knee replacement.
Well, first of all, I was active up until I was in my 50s. And then knees started bothering me. They would swell, and I was slowing down, and eventually knew I was going to have to do something.
When did you reach that point? I guess what finally made you seek Dr. Nix's consultation?
We'd built a new grandparents' house out on 65 acres at the edge of town. And I realized that I was sitting on the deck watching the grandkids go do the things that I should have been out doing with them because of knee pain. So when I got to that point, it's time to seek some help.
That's when it really hit home. And Dr. Nix, I realize he's not alone in this at all. How common are we seeing this, I guess, in people probably as they age?
It's amazingly common now. People gradually lose the ability to exercise, and then chores, shopping, housework, yard work just can't be done. And one of the most common operations done in orthopedic surgery is knee replacement.
And who are candidates? I mean, how do people know? I realize Jim kind of told us when he got to that point, but how do most people know if they're candidates to have that?
Well, we look at what the eliminations of what they're not doing. Is an inability to exercise. We all need to do that. The chores, the shopping, the housework, and travel gets to be intolerable. So the frustrations grow and grow, and then people seek some help.
Jim, back to your story. I mean, how have you noticed a difference, I guess, in your activity and especially maybe with your grandkids?
Oh, yeah. I'm back to where I was in my early 50s anyway. And I'm able to go and do. I go to HealthWorks 3 or 4 times a week. And I'm doing 3 miles a day usually.
Wow. So it's keeping that strength up, I guess, in your legs. And Dr. Nix, I realize everyone's body's different. We all react differently to different things. But are these normal results? I mean, is this what people, is Jim a good example of what people can expect if they have knee replacements?
It is. Well over 90% can achieve good to excellent results. And Jim's been exemplary. He stayed trim. He's done his exercise and everything that you want out of new joints.
And I realize maybe in men more so than women, sometimes we kind of put things off. We wait on going to the doctor, on getting consultations. Do you see that in a lot of patients? I mean, men and women, maybe they wait too long to come to you guys?
Well, the eliminations, I mean, when they're unable to exercise, then we can tend to put on weight and lose our fitness edge. And so that's alarming then. Yes, they do.
And we've seen your lifestyle, I believe we're gonna see in some of the Baptist Health commercials. How many autographs you signing down in El Dorado this time of the year?
It's amazing the power of advertising,
right?
I'll tell you. I've heard from people that I hadn't heard from in years.
I'm sure. You got a little bit of a prop there with us, Dr. Nix. Show us a little bit about that. I guess this is how our knee kind of works.
This is a model of the knee implant and how it moves like this. The stainless steel alloy on this polyethylene bearing or medical grade plastic, if you will.
Right.
And the friction of that is slicker than a sled runner on ice. It's cemented into the bone, and this is the knee that Jim has now, so it's very heavy.
So you got one of those in your leg right now?
2 of them.
2 of them, sorry,
Yeah. So, but they work very well, and his rehab's gone just by the textbook. So And that's the result that you hope to see.
Right. Well, I'm glad both of you gentlemen could come in. We got 3 guys from El Dorado sitting here. I think that's kind of a neat thing, South Arkansas being well represented. And Jim, I'm glad to hear about your success story. And Dr. Nix, you obviously have done a great job, I would say, by listening to his active story. So thanks, guys, for joining us. We're going to have more of Good Morning Arkansas coming up right after this.